Hi, Rochelle Schultz, CEO of Winona Health, and I'm here on another topic that I wanted to share some updates with you. And this has to do with our resumption of elective surgeries. So you may be aware that back in March, the governor had put out an executive order that had asked all healthcare organizations to sort of cease and desist, if you will, with elective surgeries and procedures. And this was really around two issues. One was protecting patients because we didn't know a whole lot about the COVID situation at the time. But actually what overtook that whole situation was the issue of PPE, or personal protective equipment, and having enough to be able to take care of what was expected to come in from a patient perspective, to take care of our staff, protect staff as well as patients with enough PPE. And there had been a lot of shortages of that, of course, kind of across the state. A lot of that has resolved itself in the last, sort of month or two, as organizations have been identifying, where to get this PPE. And certainly in our community, the great generosity that we have experienced from so many of our, area businesses and staff and volunteers and just individuals in our community who have, been gracious and given us what they've had available. And so we sit in actually a pretty good position as far as PPE goes and equipment and all of those types of things. So recently, last week or so, the governor had released, on his executive order, the restriction on doing elective surgeries so that we could start this week, actually, on the 11th of May. We had already been doing, some surgeries that were more emergent, that, really just couldn't wait, but certainly most of that volume had been postponed. So we have kind of that prior volume that we need to now incorporate, into our surgery schedules and so forth. And we have a whole team around all of that. The surgeons are, very involved in that and identifying and prioritizing, cases and those types of things. And so as we are going forward here, May, June, and through the summer, there's a whole lot of work that's going around, incorporating and accommodating what has been postponed into schedules, surgeries over the next few months. Now, in all of that, we didn't want to overwhelm, our processes here, and we want to be very thoughtful and very methodical about how we bring surgery back on. And again, making sure that we're doing all of the things like social distancing, in our planning and protection, infection protection, sorts of activities. So for May, we were really just planning to get up to 50% of our surgical capacity. In June, we're looking at 75%. And then July 100%, or 100+%, if you will, to just incorporate and pick up all of that backlog that was there. So we certainly appreciate the patience that people have had in terms of waiting. And again, lots of thought really going into how we stand up that service and do it in a way that is very supportive of patients as well as our surgeons and our staff. A couple of things that are important to know from just a process perspective, again, the protection piece is that, a couple of key changes that will impact a patient is that, we'll start doing testing. The plan is to do it like 5 days before your surgery, and then 3 days before your surgery is to do, one of the COVID tests to make sure that we have 2 negatives, if you will, before a patient goes into surgery. Again, that allows us, to preserve PPE so that we don't have to go to, extensive efforts, because, that just consumes a lot more PPE than what would be normally required. And additionally, on the consent forms, we've incorporated just, some conversation about the COVID issue, so that, the surgeon, will talk to you about that as far as your surgery goes. Again, we have, in terms of our disinfecting, all of the things that our staff have been following, the PPE garb, I mean, just everything. I think we have felt very comfortable in opening up our surgery practice again, making it very safe for patients, to come in and have procedures done. We know lots of people have been waiting, and it's been tough, for some. And so again, we really appreciate that, and our surgeons will, get you on their schedules just as quickly as they can. I think that, as we go forward, we have to also be prepared, and these are some of the requirements of the state for surgery services to continue. We always have to be prepared that if there were an outbreak in the community, for example, that we could dial back, some services to ensure, again, that we would have sufficient PPE, that, we have sufficient hospital beds, or ICU beds, or those kinds of things. So, what's a kind of a beautiful thing given our size is that we've got a great deal of visibility across our whole organization. We know who's coming into our hospital, who's in our ED, who's coming through the clinics, the surgical, patient population, if you will. So we know what that movement and flow is, and we have, a great ability to make sure that we're balancing, all of those types of considerations so that, we're taking care of everybody, appropriately. So should anything arise in the community as far as that goes with an outbreak or any of those kinds of things, we've got, really good plans in place about how we would surge up or surge back and those types of things. So COVID isn't going away. It just has become part of what we have to think about in terms of our planning, our delivery of care, protecting patients, protecting residents, protecting our healthcare workers. And I think we've learned an awful lot over these last couple of months. We've got some really great plans in place. And one of the things that we do extraordinarily well is we execute on our plans really, really well. So just wanted to give you an update on where surgery is at. We welcome patients. If you have any questions, make sure you're asking those questions of your surgeon or any of the clinical staff that may be contacting you as you get these appointments set up. We again want to make sure that you feel comfortable, and we certainly appreciate being able to take care of you. Thank you.